Hey everybody, it's Dr. Stott here at Smile Now Dentures and Implants in Boise, Idaho. I just wanted to talk to you a little bit today about implants and what it means to people to be able to have the opportunity to get implants. Of course, when we talk about implants, we're talking about the best tooth replacement option possible. Well, implants are the only solution to missing teeth, to rehabilitating teeth that are no longer savable, no longer able to function properly in your mouth. All right, so I'm gonna go through 3 patients really quick, people that I've treated here in my clinic, and what their experience was and why dental implants to replace or restore missing teeth was the best option for them. Okay, so the first patient I want to talk about is a patient that came to us because he had a really hard time just being in public, being able to smile, being able to communicate. He was somebody that was trying to get his life up and going as far as starting a business for himself, being able to interact, communicate with people. And looking at this photo that we have here of him, you can just see that there's a lot of things going on. So looking at this photo of this patient's teeth, a couple things are going to stand out. Like, first of all, you're going to be able to look at them and notice that there's a lot of white stuff on his teeth. So this is actually dental plaque. So dental plaque is the result of not adequately cleaning your teeth, brushing maybe the way that you should, flossing, maybe not 100% efficiently. And so it's built up on his teeth over time. And then you see a lot of brown spots. So these brown spots are typical of the discoloration that you will see when you start to get dental decay. What I mean by dental decay is that the bacteria that is on his teeth, as they consume their nutrients from the food that we also eat, they emit out an acid that will actually chew holes or bore holes into your teeth. So he's experiencing a lot of that. In addition to that, you can see that he's missing a lot of teeth. There's no teeth on the lower left, right? There's no teeth on the lower right. So he has something called an overbite. Maybe his lower jaw is actually set back just in the way that he grew, in the way that he matured. And so here's somebody that doesn't have any back teeth, is unable to function, can't really chew the types of foods that he wants to, can't be in public, can't smile at people and be confident about it, had a lot of mental health issues. This patient did have a history of drug use. And what he's looking for more than anything else is just a clean slate. He wants to be able to not live with the ghosts of his previous decisions in his life constantly dictating what he can and cannot do. And with his teeth the way that they are, there really were not a lot of options to keep them. And so if we look at his x-ray too, right here, you can see that he's had a lot of previous fillings. He tried really hard to maintain the teeth that he had. You can see down below that he has little tiny root tips underneath the gums, above the gums from broken teeth. This is painful. This causes a lot of infection. It really makes it so he's not at his best. And then you can also see that there's a lot of bone loss associated with what's been going on for decades with this person. So when we brought him in and talked to him about the different options for treatment, really the number one option that we had was to eliminate the problem. That means take out the teeth, eliminate the issues associated with what the teeth had done. That means get rid of the infections. That means get rid of the root tips and the decay and the bacteria, and then move on and get past that part of his life by using dental implants. So implants are the number one option for dental rehabilitation when you are missing teeth or when you have teeth that no longer have the option to be used as a good foundation for a future smile. So what did we do on him? Looking back at the x-ray after treatment is we actually used quite a few different implants. You can see that he has angled implants. The reason we use angled implants is because we're avoiding the sinus. By avoiding the sinus, we're avoiding how long it takes to actually get your teeth, how long it takes for you to heal. Sometimes people will do bone grafts up in the sinus, which is not bad. That actually works out really well. However, it adds a lot of cost and it adds a lot of time onto your treatment. So we used angle implants in this situation. You'll also see implants in the back. So these are implants that engage into what we call the pterygoid. So the pterygoid is just like an area, a complex in the back where parts of your bone fuse together to create a hard plate. And by putting an implant back into this location, we're creating a lot of stability and we're eliminating issues like cantilevers, like excessive forces on the implants after we get our final teeth. These things help this type of procedure last a lot longer than what it might last should you only do 4 implants. So you can see that going on. We were in this specific situation, we were able to put 5 implants down below. That's more than what people typically talk about when they talk about all on 4. That's just an insurance policy for the future, to be able to have a smile that's longer lasting and that lasts a long time, especially because this patient is so young. So we did 7 implants up top for him, 5 implants down below, a total of 12 implants. And looking at the results, you can see that this is a smile that looks a lot better. It's wider. It looks more characteristic. You can see that he no longer is biting down on his lower tissues, but you can see a little bit of his lower teeth. You can see his upper teeth. And this is done on purpose. This is done by design. We wanted him to feel youthful. We wanted him to feel his age. We wanted him to be able to smile with confidence. And you can see in his eyes that there's a little bit of a glow of how he feels about himself and the confidence that he's gained by improving his situation, all done with dental implants to replace his missing or broken down teeth. So this is one patient. Okay, so the second patient that I wanted to show is somebody that is a working professional. So she is involved as a makeup consultant, working with people face to face all the time. The thing that she was dealing with was she lived overseas and she actually had a lot of dental work done, which was great work, and it was great work for what it was. What we're looking at when we look at the specifics of that is you see a lot of metal in her mouth. You see a lot of crowns that are made out of metal to make them stronger, and then they had a facial portion, or the front portion that you would look at, that was covered in porcelain to make it look like natural teeth. It had started to break down. The porcelain was chipping off. The mouth is the source of a lot of different forces. Chewing food, just biting together, all the different things that we do with it had worn down her previous dental work so that it was no longer functional. She was also missing a lot of teeth. She had these, and these are called dental bridges, and they spanned more than 2, 3, 4, sometimes even 5 teeth. So really she didn't have anything under them to support them, just a long dental bridge supported by natural teeth that were also having issues. She was having a hard time feeling like her teeth fit the way that she felt about herself. She felt like, these do not improve the way that I look, these take away from the way I look, and she wanted to improve her smile. When we look at her x-ray, we also see many broken teeth. So even though there were dental crowns, there were root canals, there were, a lot of work, previous implants placed to try to improve her smile, to try to give her not just function, but like the aesthetic appeal or the looks of a good, healthy smile, she wasn't getting that. So when she came to me and we looked at everything, we just decided that this isn't a situation where you have a great foundation, minimal teeth left, to be able to use those and keep those in creating the brand new smile that you're looking for. So what we did is, looking at it, is we used 6 dental implants up top and 4 dental implants down below. In this picture, you can see some were straight up and down. We had ample bone in order to do that, so that's no problem. We also had angled implants because we wanted to avoid sinus lifts. So one thing that we do at Smile Now Dentures and Implants is every single patient comes in and they get what we call a cone beam, or a 3-dimensional x-ray. The 3-dimensional x-ray gives us all the information that we need in order to treat a patient. We know how much bone you have, we know what the quality of the bone is, we know where it's located, and we can even do digital designs of what your smile will look like based off of this information. And then you can see that she has teeth that are the best quality material that we can provide, which is zirconia, which I've talked about in different videos. So when you look at her finished smile after treatment, her specific treatment took about 4 months total from the time of surgery. She got a set of teeth on the same day, which is what you're looking at here. These teeth, I cannot tell the difference between final teeth and these teeth and the way they look. These teeth are really beautiful. They match her overall appearance. So you can tell that her smile, it comes down and it follows the lower lip. This is a smile design that was done on purpose. You can tell that the width of her teeth and the length of the teeth and the color of her teeth were all designed to complement her. And so this is just really beautiful. And this is one of my favorite cases as far as the outcome, because she deserves a smile like this. Now, this was, like I said, these are the provisional teeth. When we do provisional teeth, we're using a material that's 3D printed. We do it immediately on site. when people come in to see us, what they're receiving is they're receiving a very comfortable surgical experience. They're put to sleep 100%. It's super safe for them. There's no medical emergencies as far as that goes. If you do have a medical history, this is something that we discuss with you ahead of time. This is something that we're aware of. Not just me as the provider, not my partner as a provider, or anyone in any of our clinics, but also we go over it with our team, which includes the anesthesiologist or the certified registered nurse anesthetist. So we have many eyes looking at you, trying to keep you, like, making it safe for you, making it the safest possible experience that you have and the most comfortable experience that you have. After we got her final teeth, you can see here an amazing glow up. You can see her smile is infectious. You can feel it. You can't get rid of it. Every time she comes to see us for her recare, her recheckups on her implants and how they've been doing, there's nothing but happiness beaming from her. And I'm just so happy that we had the opportunity to give somebody something that they already had inside of them, and we were just part of the process of bringing it out of them. Third patient that I want to talk about is a little bit different than the first two. The first two patients that we talked about, they didn't really have the option to keep any teeth because their teeth structurally were not sound and could not be used as a proper foundation to restore their smile. This patient was a little bit different. He didn't have a lot of structural damage. He had what we call periodontitis. So periodontitis is when your body really attacks the bone or cannot maintain the bone around your teeth due to the types of bacteria that are there. And what these types of patients experience is a lifetime of cleaning, a lifetime of taking care of things. Now that's okay, and a lot of teeth can be maintained that way. And if it's the preference of the patient to do that, we fully support that and we want them to do it. This patient, on the other hand, did not want to do that. He was sick and tired of having to go into the dentist, having to get cleanings regularly, every 2 months, every 3 months, of it hurting every single time he went in. You can see here that he had a lot of stains on his teeth, and this isn't actually on the clinical crown, or the anatomical crown is what we call it, but the crown that you see, the actual tooth structure that you see, this staining was on the root structure. Now the root structure, it's the part of the tooth that is more sensitive, where you can feel what's going on when you get those shocks of cold or you feel heat, excessive heat on your teeth, and it's really uncomfortable, and it provides that lightning strike of pain that comes and goes very quickly. Those are the types of things that happen when you start to get root exposure on your teeth. He probably drinks coffee. I think he smokes cigars a little bit, but overall, it's just not the appearance that he wants. Now, this patient is a superintendent. He's somebody that works in HR. He is talking face-to-face with people all the time. He does hiring, he does firing, he does disciplinary, and he also rewards people that are doing a really good job. What's really difficult for him is just to have the confidence of being respected, of people not judging him, because as unfair as it is, there's a lot of judgment when it comes to your teeth. He was looking for a better solution. We look at different parts of his mouth. You can just see that there's a lot of bone loss. The way we know that is because we can actually see the tooth structure. The gum tissue itself is pretty good because he does a good job at taking care of himself and getting those annual cleanings and whatnot. But things that you don't see here is that there's movement in his teeth. I could take my fingers and I could move the teeth. So it makes it a harder situation to take care of it. And even in one of these pictures, you can see there's a little bit of bleeding, and bleeding is a sign of infection. After we talked to this patient numerous times, we talked about all his different options, maintaining teeth, keeping them, continuing to get cleaning, continuing to get care, or we could just start over. We could do a clean slate, and we could take these teeth that were ailing, that were sick, that were having hard times, and we could replace them with dental implants in such a way that his quality of life would remain the same or get better from not experiencing the pain, and that he would be able to function properly and have confidence in his smile. Now, I've been working with this patient for over a year, and we see this patient all the time, and we're so happy for him. Every time he comes in, he's just beaming with excitement. He's talking about how wonderful his experiences have been, and he's talking about how if he could do this again, he would do it in a second. This wasn't too expensive in hindsight. This is something that he felt improved his life and improved his situation in every aspect of his life. Here we're looking at him. This is right after treatment. You can see that the teeth are designed in such a way to complement him. They're a little bit masculine, right? So they're a little bit more square shaped. It's done on purpose. His upper teeth still follow the lower lip line. And then you can also see that the color matches. It's not too bright, it's not too dark. It just looks like he does a really good job at taking care of his teeth. You can see in his eyes, in comparison to the beginning, that he has more happiness, more hope in his eyes. We're really happy that we were able to help this patient. Again, all these patients, they underwent what we call all-on-6 surgical procedure, where we can remove all your bad, decayed, ailing teeth, and we can smooth your bone in such a way to make it a great foundation for more than 4 implants, 6 as possible, even more sometimes, so that we can replace your teeth with a brand new set of teeth that helps you be more confident, live a better life, be happier, feel less pain, and overall just have a better quality of life, which is our goal. I'm grateful that you guys took time to be here with me, to talk to me a little bit about what we do at Smile Now Dentures and Implants. We have multiple clinics all across the United States. We're here to help you. Patients are our number one priority. We do offer free consultations. If you come in for a consultation, we can sit down with you, talk to you about your specific situation. It might be that we recommend that you keep your teeth and that we just do whatever's necessary to maintain them. It could be that you're in a situation like these patients that I showed, where the foundation for keeping your teeth is inadequate, that your teeth, trying to save them, actually is creating bigger problems down the road, and that we're just punting the problem down the road for us to deal with it at a later time. And if you're sick of that, if you're sick of not having solutions, if you're sick of not having the opportunity to feel the way you want to feel, to smile the way that you want to smile, we can definitely help you out and would love to do so. Now, if you have any questions, if you have any comments or concerns, you can actually put them down here. And if you want to see more stories like this, you can follow us as we share these types of experiences. So this is Dr. Stott at Smile Now Dentures and Implants, sharing this information with you. Happy to answer any questions. Reach out to me if you want directly. I actually talk to a lot of people online to help them with their implant journeys, and I'm happy to do so. We'll see ya.